Hi friends, in this series of ECG basics, today I will talk about multifocal atrial tachycardia and the ECG changes in it. First is a disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Multifocal atrial tachycardia. It is a rapid, irregular atrial rhythm arising from the multiple ectopic foci within the atria. It is most commonly seen in patients with severe COPD or congestive heart failure patients. It is typically a transitional rhythm between the frequent premature atrial complexes and atrial flutter or fibrillation. It is also known as chaotic atrial tachycardia. The ECG features are heart rate is usually more than 100 beats per minute, and usually it is between 100 to 150 beats per minute, and it can go as high as 250 beats per minute. We get irregular rhythm with varying PP, PR, and RR interval. We can get at least three distinct P waves morphologies in the same lead. Isoelectric baseline between P waves. There are no flutter waves. There is absence of single dominant atrial pacemaker, that is not just a sinus rhythm with frequent PACs. Some P waves may be non-conducted and other may be aberrantly conducted to the ventricles. There may be additional electrocardiographic features suggestive of COPD. The clinical relevance, it usually occurs in seriously ill elderly patients with respiratory failure, for example, in exacerbation of COPD or congestive heart failure patients. It tends to resolve following the treatment of the underlying disorder. The development of multifocal atrial tachycardia during an acute illness is a poor prognostic sign, and it is associated with 60% in hospital mortality and is the mean survival for just over a year. Death occurs due to underlying illness, not the arrhythmia itself. Mechanism behind the multifocal atrial tachycardia, it arises due to a combination of the factors that are present in the hospitalized patient with acute or chronic respiratory failure, right atrial dilatation from the cor pulmonale, increased sympathetic drive, hypoxia and hypercarbia, use of beta agonist theophylline, electrolyte abnormalities like hypokalemia, hypomagnesemia secondary to diuretics or beta agonist use. The net result is increase in atrial automaticity. This disease shows multifocal atrial tachycardia in the form of rapid irregular rhythm more than 100 beats per minute, and we can see at least three distinct P wave morphologies. The arrow signifies the P wave morphologies. Multifocal atrial tachycardia, besides these changes, we may have additional features of COPD. Like in this ECG, we can see a rapid irregular rhythm with multiple P wave morphologies. We can see right axis deviation, dominant R wave in V1 and deep S wave in V6, suggestive of right ventricular hypertrophy due to cor pulmonale. Ralph Waldo Emerson has said that the first wealth is health. With this, I conclude my today's topic. Thank you. Keep learning.